Mr. Speaker, that was a very, very ironic speech from a member who is bailing out of the National Party, not willing to stand again in Napier because Stu Nash was going to beat him at this next election. And what is he doing now, Mr. Speaker? He's now helping Stu Nash win the seat for Labour. That is what that member is doing. So I found that speech very interesting when he wanted to name the Labour members who wanted to retire, forgetting that he was doing that himself. I actually have found it almost cringe-making to listen to John Key, Bill English, and now Chris Tremaine today, crowing about how much better New Zealand is doing than Australia under a national government. They did it on Budget Day. Chris Tremaine did it today. Well, you know, they remind me of one of those. Cricket commentators we have in New Zealand. We win one test out of 4 and suddenly we're the world champions. So the National Party think because for 1 year we've got a better record in some things in Australia, we're now doing far better than that country. Well, I say before they get too cocky and make us look like fools, let's have a look at just a few facts. The unemployment rate in New Zealand has, after 5 years of the National Party, is now on a par with Australia. The Australian GDP per capita is around 48,000 in US dollars, and New Zealand is 30% below. That is today. The New Zealand government's surplus was at 3.7% of GDP in 2007, and it went to a deficit of 5.1 in 2010, while the Australians had a surplus of 1.5% in 2007, and they ended up with a deficit of 5% of GDP in 2010. In other words, the last Labour government left the National Party in a much better state to handle the GFC than any other country in New Zealand. And I have to say, Mr. Speaker, have a look at the growth projections in the New Zealand budget and have a look at the growth projections in the Australian government. In 2015-16, the growth projections in Australia passed New Zealand. In 2016-17, there's an even bigger projected growth in Australia compared to New Zealand, and in 17-18, it is the same. I have to say, Mr. Speaker, one swallow doesn't make a summer, and 1 year when we might have beaten Australia doesn't mean that we are now in a better position. And I cringe when we go into that sort of behaviour, and the Aussies must be having a good old laugh over there as well. Mr. Speaker, one of the things that John Key has been saying about this budget is that 12% of households now pay 76% of all net tax in New Zealand. Well, I need to tell the members of it, there's no such measure as net tax, and he's totally untrue in what he's saying because he ignores GST. 40% of our tax take comes from GST. And who pays most of the GST in New Zealand? Those are middle and low income. In fact, low income spend almost all their money, and that means they pay GST on everything that they buy. But I want to turn to the health budget, Mr. Speaker, and say now for some real facts about the health budget. Here are some truths about what's been happening to health funding under Tony Ryle. I think it's now time to put aside the political slogans that have been posturing as a health policy and look at the impact of 6 budgets under this Minister of Health. Did the members opposite realise this when they were clapping and cheering on Budget Day, that the health budget has been reduced in real terms by 2.3% in this budget? They're not my figures. They are Treasury's own figures, and they are in the blue book if they want to go and look at them, if they've taken time to read. The shape of health for the future under a national government, if they are re-elected, does not look good at all. Not my figures, Treasury's figures. And they're not old figures either. They are the latest figures and projections in the budget documents put out by Treasury, who we heard today from Mr Joyce when he wanted to quote Treasury, we shall be listening to. So let's have a look at what these figures are. We've got 2.3% less in this health budget, that is in total expenditure, and we're going to have, when we look at 2015-16, 3.7% less, 2016-17, 3.6% less, 2017-18, 3.1 less in real terms. And I have to say, Mr Speaker, those figures are from the budget projections in the National Party's own budget. Did New Zealanders know that? Did they know that they not only cut this year's budget by 2.3%, the health budget, in real terms, but they are projecting cuts out through the years of the health budget? That is the truth, Mr Speaker. That truth needs to be reported in the media, and I'm really disappointed that a fact like that, that's going to affect people's health, the services they provide, and perhaps the way they vote, is not being portrayed in the media. Those are big cuts in health when you consider what all but one budget of Tony Ryle's has cut the health budget. And we now know what is happening in health in terms of the provision of services. And then next year, should the National Party win, they're going to say, oh my goodness, oh no, there's been cut in health care. I've heard that my mum can't get an operation on her dodgy hip, or her home help has been cut. Well, I have to say, Mr Speaker, wake up, New Zealand. They have cut the health budget. You vote for them, and they're going to cut it every year in the foreseeable future. In this budget, Mr Speaker, we did welcome the under 13-year-old free doctors' visits, but the devil is in the detail. And the questions I was asking today wasn't to criticise the fact there was free health care for under 13-year-olds. After all, after the budgets of the 1990s, when affordable health care and subsidies were taken away by Ruth Richardson and the National Party, I was the minister who brought them back in. I am very committed to affordable primary health care. But what they have not provided to our doctors is what is the level of that subsidy that's going to be provided to give that service to children free. And I have to tell you that the New Zealand Medical Association has said publicly that they may have to cross-subsidise and charge adults more if the amount paid per child per visit each year is insufficient. And the question I would then ask is, what impact will that have on our old folk? Those who are on fixed income, they live on the pension, they have nothing else, and many of them are saying to us now, paying $45, $47, $50 for a doctor's visit is already too much from our pension. And if they're going to cross-subsidise for children, what is the impact going to be on those people, important people in our community? So it's up to the government now to tell us what is that subsidy that's going to be provided. The $30 million per year over 3 years, will it cover the cost? Because there's no doubt in my mind that doctors are not going to just do it for free. There's no free ride here. Somebody is going to have to pay for it. Another feature of this budget is the Minister said there's going to be another $100 million for elective surgery. Well, I have to tell you that it's $100 million over 4 years, not 3, over 4 years. $100 million over 4 is $25 million a year across 20 DHBs. Is about $1.25 million per DHB that they will receive. Don't expect to get your hip done anytime soon. And then we come to public health, Mr Speaker. $1.25 million per DHB each year. 1.25 more, and $1.25 million will not pay for many hips. And as for public health, under this government, they have cut public health by $16.2 million out of public health. Have a look at the figures, Anne Tolley. Don't shake your head. That is what they have done. And then they have the cheek to talk about obesity and stomach stapling.
I call Dr. Paul Hutchison.
Mr. Speaker, it is a great pleasure to have a call on this excellent budget 2014-15, and what a coincidence it is that Annette King has just spoken about figures, because she was